Hello, I am Dr Sandeep Nayani, consultant neurologist, Apollo Hospitals, Hyderabad. Today I am going to talk about brain hemorrhage. Brain hemorrhage is a condition in which there is bleeding inside the brain or on the outside in the brain coverings. So it is of different types depending on where the bleeding has happened. If there is bleeding on the coverings of the brain, whether it is inside or in between the coverings, we call it extradural hemorrhage or subdural hemorrhage. If there is bleeding in the brain spaces, it is called subarachnoid hemorrhage. Or if there is a bleeding inside the brain in the brain parenchyma, we call it intracerebral hemorrhage. So the bleeding in the brain coverings or outside the brain usually happens due to a trauma or a fall when someone experiences a road traffic accident, or especially in elderly people, even with trivial falls, there can be bleeding in the brain coverings. So this can present as drowsiness, vomiting, severe headache, change in consciousness. So these patients may require surgery in form of a burr hole and evacuation or removal of the hemorrhage that is formed. Whereas the second type of hemorrhage, which is subarachnoid hemorrhage, that is hemorrhage in the brain spaces, this may happen due to trauma, or more commonly it can happen due to rupture of an aneurysm or an abnormal blood vessel inside the brain. So this also requires urgent treatment in form of surgery, in form of either coiling or clipping to treat this condition of subarachnoid hemorrhage. The third type of brain hemorrhage is intracerebral hemorrhage, where there is bleeding inside the brain substance. So this type of bleeding may happen due to sudden increase in BP, or it may happen due to medications like blood thinner medications that are taken, or it may happen due to abnormal blood conditions. So in this type of hemorrhage, especially if it is due to high BP, it can present like a stroke in the form of hemiparesis, that is one-sided weakness, or change in speech, or change in consciousness. So this type of bleeding may require medical treatment, good BP control, and in some cases it may require surgical therapy to improve the symptoms. Thank you.